Trudy, the Premier says that the risk may be just getting too high.
Gab, we've seen the fight over international arrivals for a long time now. Plenty of state premiers have raised this issue in the past. National Cabinet has not been meeting for the last few weeks. It will return this time next week. And as we heard there, the Queensland Premier making it clear that she wants this issue to be top of the agenda. The mutant strains of COVID-19 that are being picked up in the Queensland hotel quarantine system, she argues is posing a big risk that we will continue to see these sort of short, sharp lockdowns like we saw in Brisbane if we don't have the vaccine rollout speed up. And before that can happen, she's suggesting that there needs to be a rethink on the numbers right across the country.
What we are seeing is these infectious strains now coming into Australia, and that puts the whole public at risk. So maybe until the vaccination program is ramped up by the federal government, the number of return travellers needs to decrease Australia-wide. So these are some of the issues. And these are legitimate issues that I think Queenslanders would want me to raise at the National Cabinet level.
It's certainly been a week dominated by fights between the states and the Commonwealth when it comes to the pace of the vaccine rollout. That number of vaccinations across the country has now ticked up to around 744,000, but well short of that 4 million milestone that had been promised by the end of March. But amongst all this bickering, the Victorian Health Minister today saying it's not actually going to help speed anything up.
We share the concerns of Queensland and New South Wales, but we think it's time to put down our swords and to focus on the biggest single health project this country has seen in our lifetimes. Vaccinating twice 26 million people to get us a pathway out of this pandemic. It's time that this was looked at as a national priority and that the cheap politics stops.
Trudy, there's also confusion over the vaccine rollout for aged care workers.
Gab, the Herald Sun reporting today that the federal government has quietly shelved plans to vaccinate workers at aged care facilities on site and now telling them that they should be lining up at GP clinics. We know that workers in aged care were part of phase 1A and the government said that would be completed by today, but we don't have the numbers on the number of workers that have actually received their jab, but it's nowhere near every one of them. This is causing a lot of concern, particularly among Labor, arguing that the government needs to be more transparent with the number of workers who have received the jab.
And this morning we learned perhaps why the Australian government hasn't been publishing those figures, because it's now been revealed that Scott Morrison has secretly dumped his promise to vaccinate the more than 300,000 Australians working in the aged care facilities and disability facilities as a priority group in phase 1A.
So calling for transparency, similar to what we see every day when it comes to the number of COVID cases, the number of people who are in hospital. But in doing so, Gab, the government would be forced to show that the vaccination as it stands is well behind schedule.
Trudy, thank you for the update.